Good evening, friends. Delhi is currently witnessing a significant surge in seasonal respiratory illnesses, with over 2,600 confirmed influenza cases logged, primarily driven by the H1N1 swine flu strain. Data from the Delhi Health Department indicates a massive six-fold increase in H1N1 cases compared to the previous year, totaling 1,777 confirmed infections as the humid monsoon season accelerates viral transmission across the National Capital Region (NCR). Current situation. Present the latest surge statistics in Delhi: 2,600 plus overall cases, 1,777 H1N1 cases. Emphasize that while it is highly contagious, there is no need for panic, only structured precaution. Segment 1. For the general public, prevention and clean habits break down monsoon-driven transmission patterns. Focus on hand hygiene, correct mask wearing in crowded places, and navigating daily life in Delhi safely. Segment 2. For patients and caregivers, symptom tracking and home isolation, explain the timeline of symptoms: fever, dry cough, myalgia. Outline strict home isolation rules: 4 to 7 days, hydration, and critical, red flag, symptoms that mandate emergency hospitalization. Segment 3. For healthcare professionals and doctors, clinical triaging, address the medical community on Category A, B, and C triaging. Focus on the judicious deployment of oseltamivir, avoiding the misuse of antibiotics, and managing high-risk comorbidities. Epidemiological dominance. Remind the medical team that influenza A H1N1 constitutes nearly 72% of all new respiratory infections in Delhi right now, circulating alongside H3N2 and H1 strains. Judicious antiviral protocols. Prioritize oseltamivir Tamiflu for high-risk individuals and severe presentations. Do not wait for diagnostic laboratory confirmation to initiate antiviral therapy in highly symptomatic or vulnerable patients. Enforce antibiotic stewardship. Strongly discourage empirical antibiotic prescriptions. Clarify that antibiotics have absolutely no role unless a secondary bacterial infection, e.g., bacterial pneumonia, is clinically or radiologically proven. Avoid NSAIDs and ambiguous presentations. During the ongoing monsoon season, when vector-borne illnesses co-circulate, avoid prescribing ibuprofen, aspirin, and other non-steroidal anti-inflammatory drugs (NSAIDs) if dengue is concurrently suspected, as they significantly escalate internal bleeding risks. Opt for paracetamol to manage pyrexia. Comorbidity risk mitigation. Closely monitor patients presenting with pre-existing bronchial asthma, chronic obstructive pulmonary disease (COPD), diabetes, or structural heart disease, as they face the highest rates of lower respiratory tract transition and severe viral pneumonia. Implement strict IHUP reporting. Ensure all daily entries of influenza-like illness (ILI) and severe acute respiratory infection (SARI) are meticulously updated via the Integrated Health Information Platform (IHUP) to support real-time state surveillance. Understanding the monsoon spike. Explain to the audience that Delhi's current high humidity, waterlogging, and changing weather conditions allow respiratory droplets to stay viable longer in the air and on surfaces, driving the current spike. Respiratory etiquette is non-negotiable. Always cover your mouth and nose using your bent elbow or a fresh tissue when coughing or sneezing. Immediately discard tissues in closed bins and avoid spitting in public areas. Upgrade hand hygiene. Wash hands thoroughly with soap and running water for at least 20 seconds. If you are commuting via the Delhi Metro or visiting markets, carry a sanitizer containing at least 60% alcohol and avoid touching your eyes, nose, or mouth. Mask up in crowded hubs. The Union Health Ministry advises wearing well-fitted masks, such as surgical or N95 masks, when visiting crowded places like public transport, hospitals, or local bazaars. Keep sick children home. If your child shows even mild signs of a cold, running nose, or fever, do not send them to school. Allow them to recover fully to prevent rapid classroom outbreaks. Prioritize the annual flu shot. The single most effective shield against severe illness is the annual influenza vaccine. High-risk groups, including senior citizens, pregnant women, and young children, should get vaccinated immediately. Recognize common symptoms early. Watch out for an abrupt onset of high fever, persistent dry cough, sore throat, severe body aches, myalgia, headaches, extreme fatigue, and occasional vomiting or diarrhea. Strict 4 to 7 day isolation window. As soon as symptoms surface, isolate yourself in a well-ventilated single room. Maintain a strict distance from family members, especially the elderly, infants, or pregnant individuals, for at least 4 to 7 days. Home management essentials. Rest extensively and focus heavily on hydration by consuming plenty of warm water, clear broths, and electrolyte-rich fluids. Never take over-the-counter self-medication or leftover antibiotics without an explicit doctor's prescription. Monitor. Red flag. Emergency signs. Caregivers must track vital stats closely. Immediately visit the nearest dedicated hospital emergency room if the patient exhibits any of these critical signs. Shortness of breath or rapid, labored breathing. Oxygen saturation (SPO) dropping to or below 94% on room air. Persistent chest pain or pressure. Altered consciousness, confusion, or extreme lethargy. Bluish discoloration of the skin or lips. Safe return to work, school. Patients are generally safe to break isolation and return to regular outdoor activities roughly 8 to 10 days after the initial onset of symptoms, provided they have been entirely fever-free for 24 hours without using fever-reducing medicines. Table showing Delhi's current healthcare response capabilities is verified by joint reviews conducted by Delhi Health Minister Pankaj Kumar Singh and Union Health Minister J.P. Nadda. Facility support type, current status and preparedness level. Key action items for the public: dedicated beds and ICS adequate capacity allocated across 35 major government and private hospitals. Contact hospital help desks for dedicated H1N1 ward availability. Diagnostic Referral Labs AIIMS Delhi and the National Center for Disease Control (NCDC) designated as nodal referral labs. Mass testing is not required. Test only if symptoms worsen or under medical advice. Critical care equipment. Full availability of ventilators, oxygen support pipelines, and diagnostic kits. Monitored daily by district surveillance officers via the IHAP platform. Essential medicines buffer stocks of oseltamivir and supportive drugs fully maintained. Accessible at all government hospital pharmacies with a valid prescription. The Delhi government and the Union Health Ministry have issued a joint public health advisory urging residents to wear masks in crowded places, practice strict hand hygiene, and seek early medical care following a sharp surge in H1N1, swine flu, and seasonal influenza A cases across the capital. 1, 2, 3. As of late August 2026, Delhi has recorded over 2,602 influenza cases, with H1N1 emerging as the dominant strain, accounting for 1,777 of those infections. Union Health Minister J.P. Nadda and Delhi Health Minister Pankaj Kumar Singh have reviewed hospital preparedness to ensure adequate isolation beds, testing kits, and essential medications. 4, 5, 6. Face with mask core directives for the public. The official advisories from the health departments outline the following critical precautions. 7. Mask up. Wear triple-layer surgical or cloth masks in crowded, indoor, or poorly ventilated public areas. Respiratory etiquette. Cover your mouth and nose with a tissue or your handkerchief when coughing or sneezing. Hand hygiene. Wash your hands frequently with soap and water or use an alcohol-based sanitizer. Avoid crowds. Limit non-essential visits to densely populated areas, and avoid close contact with anyone displaying flu-like symptoms. No self-medication. Do not consume antibiotics or antivirals without a proper prescription from a certified medical practitioner. Public cleanliness. Strictly avoid spitting in public zones. Stay hydrated. Drink plenty of warm fluids and maintain a nutritious diet to support your immune system. 5, 7, 8, 9, 10. Face with thermometer symptoms to watch out for. According to the Ministry of Health and Family Welfare (MOHFW), the current H1N1 strain presents the following conditions: 11, 12. Common symptoms: sudden high fever, persistent cough, sore throat, severe body aches, runny nose, headaches, and extreme fatigue. Gastrointestinal indicators: nausea, vomiting, loss of appetite, or diarrhea, particularly common in infected children. Revolving light red flag warning signs. If you or your family members experience breathlessness, chest pain, confusion, bluish lips, or a persistent fever lasting more than 2 days, seek emergency medical evaluation immediately. 8, 13, 14. Hospital healthcare preparedness and infrastructure. Enhanced surveillance. The government has placed 35 major hospitals across Delhi under special surveillance to screen and report cases daily via the Integrated Health Information Platform IHAP. 6, 8. Referral labs. Premier institutes like AIIMS Delhi and the National Center for Disease Control (NCDC) are serving as the apex referral labs for confirmation testing. 15. Resource availability. Delhi health authorities have confirmed there is zero shortage of dedicated hospital beds, critical care facilities, testing apparatus, or essential antiviral medicines like oseltamivir. 4, 6, 16. If you are experiencing severe symptoms or have a high-risk individual at home, such as an infant, pregnant woman, diabetic patient, or elderly person, please consult a doctor at your nearest government or private healthcare center. 8, 17. 1 https://www. India Today. In. 2 https://www. India Today. In. 3 https://www. New Indian Express. Com. 4 https://www. YouTube. Com. 5 https://m. Economic Times. Com. 6 https://economic times. India Times. Com. 7 https://www. Business Standard. Com. 8 https://www. Facebook. Com. 9 https://Times of India. India Times. Com. 10 https://www. NDTV. Com. 11 https://dguess. Delhi. Gov. In. 12 https://Times of India. India Times. Com. 13 https://www. Xinhua.net. Com. 14 https://www. NDTV. Com. 15 https://www. Instagram. Com. 16 https://www. Facebook. Com. 17 https://www. Instagram. Com. Blank, _ blank. Precautions. In view of the seasonal spread of swine flu H1N1 influenza *, everyone is advised to take necessary precautions. Maintain good hand hygiene and wash hands frequently with soap and water. Wear a mask, please. Cover your nose and mouth while coughing or sneezing. Avoid close contact with people who are unwell. Avoid touching your eyes, nose, and mouth with unwashed hands. Ensure proper distance in classrooms and common areas also. If you develop fever, cough, sore throat, or other flu-like symptoms, please consult a doctor. Cases are increasing day by day *. Blank. Isolation guidelines by government. The government explicitly advises home confinement and isolation for symptomatic individuals, though it varies by severity. Under the Directorate General of Health Services (DGHS) Delhi guidelines, patients with mild to moderate symptoms are directed to stay home to check the transmission of the H1N1 virus. 1. 2. Home rules for home isolation. The official directives categorize isolation protocols based on the patient's condition. Mild symptoms Category A-B. Patients with a high-grade fever and severe sore throat are instructed to confine themselves strictly to their homes. They must avoid mixing with the public or high-risk family members. 1. Isolation timeline. Infected individuals are advised to isolate for 7 days after symptoms begin, or until they are completely fever-free for at least 24 hours without medication, whichever is longer. 2. Masking at home. If a patient must interact with family members, they are required to wear a triple-layer surgical mask. 2. Testing exceptions. The government states that patients fitting the mild to moderate category do not need to rush for an H1N1 lab test unless prescribed by a doctor. They can recover safely at home with rest, fluids, and prescribed antivirals like oseltamivir. 1. Prohibited. Home isolation is not recommended for severe cases. Patients presenting with Category C symptoms, such as breathlessness, chest pain, somnolence, or dropping oxygen levels, require immediate hospital admission rather than home care. 3. 4. 1 https://dguess. Delhi. Gov. In. 2 https://dguess. Delhi. Gov. In. 3 https://www. PIB. Gov. In. 4 https://www. Nova Hospital Meerut. Com. Blank, underscore thank you for your time, thank you for your dedication to patient care, and we will see you right here soon. Disclaimer. Compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher and YouTube will not be responsible for any harm. Closing square bracket.